Okay, this is a teaching video for Luton Dunstable Hospital on the administration of Penthrox, Penthrox being methoxyfluorine. So the license is for patients between 4 and 10 on the pain scale, adult patients with trauma. What you'll find is you'll find a box that will look pretty similar to that with perhaps more green on it. Within the box you'll find a green Penthrox inhaler, a carbon chamber, a 3 ml vial of liquid methoxyfluorine, and there's a plastic bag in here as well for disposing of the product. To put Penthrox together, the first thing to do is take out the 3 ml vial of liquid methoxyfluorine, take the top off, take the whistle and hold it at 45 degrees. Then very rapidly pour in and rotate. The objective here is to send the liquid onto the lint inside of here, and by rotating it, it soaks and creates a vapour. As soon as you've done that, you can then put this over your patient's wrist and ask them to breathe slowly in and out through the device. Because Penthrox smells, it's got a smell similar to pear drops, which is quite potent. Ask the patient to keep the first 2 breaths shallow because they will cough. Then after that, ask them to breathe in, slow, in and out through the device. If they need to step up the pain relief a little bit, you can ask your patient to put the finger over the top there. That increases the concentration a little bit. And again, breathe in and out through the device. That will then give your patient an hour's worth approximately of pain relief. When that hour's up, the patient will tell you because the device will have dried out. To dispose of it, seal the device in the plastic bag and throw into waste, and then the bottle will probably go into sharps bin.
Lovely. Damien, are there any contraindications to using Penthrox?
Contraindications, there are. So we've got cardiovascular instability, so the point at which you see your patient, if their blood pressure is through the floor or they're significantly bradycardic, don't use Penthrox in them. If they're hypersensitive to isoflurane, methoxyfluorine, clearly don't use it in them. And if the patient has the potential for malignant hypothermia, don't use it. The catch-all question is, can you take general anaesthetics? The patient's got to be conscious. If the patient's got kidney disease, we're talking end-stage renal disease, not early stage, so clinically significant, avoid those patients. And then the patient's got to be able to breathe. If they can't breathe, they can't take it in. And then no more than 2 of these a day in the same patient or 5 of these a week. And finally, we're not licensed for use at the moment in children, so that's children under the age of 18.
Okay, and after Penthrox, can it be used? So if they've come in on Penthrox, can you give the Penthrox device?
It can be. So if the patient comes in already on Penthrox and you can easily move them over to Penthrox, it's worthwhile pointing out that they won't get the same euphoria that they get with Penthrox.
Okay, lovely. And indications, actually, we didn't really cover that. So is it all trauma patients?
It's adult patients with conscious adult patient with trauma.